What every woman should know about menorrhagia. Menorrhagia, or heavy menstrual bleeding, HMB, previously known as menorrhagia or hematemunia, is now commonly referred to as heavy menstrual bleeding, HMB. It is a condition in young females, particularly adolescents and teenagers, characterized by excessively heavy or prolonged menstrual periods. It is a very common gynecological issue in this demographic, especially in the first few years after the first period, menarche, as their bodies learn to regulate hormone levels. Menorrhagia is most commonly caused by hormonal imbalances stemming from an immature reproductive system, followed by inherited bleeding disorders. Because the hypothalamic pituitary-ovarian axis is still developing, teenagers often experience anovulatory cycles, not releasing an egg, which prevent the proper production of progesterone, leading to a thickened uterine lining that sheds heavily. It's a symptom, not a disease, often signaling underlying issues like pregnancy, hormonal imbalances, polycystic ovary syndrome, thyroid problems, extreme weight changes, excessive exercise, stress, or structural problems, and requires medical evaluation for diagnosis and treatment. About 80% of cases of menorrhagia are attributed to dysfunctional uterine bleeding. Fibroids are the most common structural lesion related to heavy menstrual bleeding, while endometriosis and adenomyosis are said to be associated with menorrhagia, but the main symptom is the enormous pain. Symptoms also include mood symptoms, irritability, mood swings, depression, and anxiety. Physical symptoms: bloating, breast tenderness, insomnia, fatigue, hot flashes and appetite changes, and cognitive changes, confusion and poor concentration. Symptoms occur in the second half of the menstrual cycle, luteal phase. The best treatment for menorrhagia, heavy periods, varies, but hormonal IUDs like Mirena and tranexamic acid are often most effective, followed by NSAIDs, ibuprofen, combined birth control pills or progestin, with hormonal IUDs generally being a top first choice for many, reducing bleeding significantly by thinning the uterine lining. Progestin is also a frequently prescribed medication for menorrhagia, likely because of its safety in the setting of other medical comorbidities and its efficacy. Therapy with this drug results in a significant reduction in menstrual blood flow when used alone. If medications fail, surgical options like endometrial ablation or hysterectomy, uterus removal, may be considered, but always consult a doctor to find the right fit for you. If menorrhagia is left untreated, it can lead to serious complications like severe iron deficiency anemia, causing extreme fatigue, weakness, and shortness of breath, impacting heart health and daily life, alongside potential fertility issues and mental health problems, anxiety, depression, and masking underlying serious conditions like uterine fibroids, endometriosis, or even cancer, potentially leading to life-threatening blood loss or requiring more invasive treatments. What to drink when bleeding is heavy? Staying hydrated to help maintain your blood volume is essential. So make sure you drink 4 to 6 extra glasses of water each day of your period. Losing too much blood during your periods can reduce the total amount of blood flowing around your body, blood volume. Also, extreme blood loss can lead to anemia so severe that it becomes life-threatening, sometimes requiring a blood transfusion. Menorrhagia is linked to many health issues. These include problems with the uterus, hormone problems, or other conditions. While heavy bleeding can make it tough for you to take part in your normal daily life at times, there are treatments to help. Vitamin K deficiency in a woman with menorrhagia can severely worsen the condition by further impairing the body's ability to form blood clots. Because vitamin K is essential for the production of coagulation factors, a deficiency of vitamin K can lead to defective coagulation, resulting in uncontrolled or significantly increased menstrual blood loss. The final conclusion regarding the causes of menorrhagia, now often termed heavy menstrual bleeding or HMB, is that it is a multifaceted condition that often results from a combination of structural uterine abnormalities, hormonal imbalances, and underlying medical conditions. While it can occasionally be idiopathic, no clear cause found, it is most commonly attributed to specific treatable factors that disrupt the normal menstrual cycle. If you found this video educational, hit the like button and subscribe to this channel for more educational health videos.